SoundBite was introduced to our practice in 2012. I had no idea what it was, and the demonstration is what got me interested. It was a music demonstration, and it was just amazing to me, the sound quality and the clarity. So I thought, if personally with normal hearing, if I can hear that well, what can this do for patients? One gentleman in particular said, when I go into noisy situations, I'm less stressed. I do a lot better now. He said, I just can't imagine not wearing it in those environments. I think it's the shock that it's really going to work without having surgery. For our single-sided and conductive hearing loss patients, it's difficult because when their friends are on their deaf side, they always have to position themselves differently when they're in especially noisy environments. When they come in to see us, they're very frustrated. Many of those patients think that they have no options. So by the time they get to us, they're at their wits' end, and they just basically come in kind of forlorn. So when we offer them their options, it's kind of an uplifting experience for them, because they know now that they have an option, either surgical or non-surgical. I think part of the reason people walk away from different options is because, number one, they perhaps don't want to have surgery. They may have come from different surgeries, and having a surgical option is just not an option for them. A second reason, I believe, is that they don't want to wear two devices as an across system. And the SoundBite is a very comfortable option for them, because they have one device on one ear and in-the-mouth device in their mouth. And for those patients, it's more comfortable, it's more convenient for them, and they just think it's an easier solution. The sound quality between bone conduction and air conduction, I feel a lot of patients think that the bone conduction is a clearer sound quality because it's a direct contact right with the cochlea. You don't have to worry about going through the outer ear, the middle ear, and then into the inner ear. It goes directly from the processor through the bone right into the cochlea. So it's just a much clearer, crisper sound quality. In our aided audiograms, after we fit the SoundBite, we've had a very, very good outcome measures, and we have seen the aided has matched their good ear. So we have seen that high frequency output has been outstanding. In our practice specifically, we see many, many single-sided patients. So when a patient comes in specifically requesting a SoundBite simulation, we do the demonstration. Usually they'll bring a loved one with them, so we'll have them sit on their deaf side and start talking to them, and the reaction is usually very surprised for most people, because they don't expect this little piece on their teeth to actually conduct sound. So it's very exciting, both for the family members and for the patients coming in. I had a young lady, she's a nursing student, and she was very excited. She just looked at her mom and she said, "This is going to change my life." They're ready to go, and they want to walk out the door and start hearing. And that's been a very positive experience for both our clinical staff and for the patients that we fit. This is a very easy device to simulate in the clinic, and it's definitely worthwhile for those patients who are not interested in the surgical option and who have patients who are in a cross perhaps that are not satisfied. I think this is a great option for those with normal hearing on one side, and even the conductive hearing loss patients who are not satisfied either with their hearing devices currently or cannot wear a traditional hearing aid. This has been a great device. We have several patients in our clinic who have a conductive hearing loss, and we've fit the SoundBite, and they're very, very satisfied.